I will, sorry for this, I would need, okay, sorry for this. Today I will speak about the clinical field MRI system aspect and all the different types of applications we went through in the past 11 years of operation of that system. So I specifically introduced a gradual steps from the basic first introduction of the system in our lab at a very critical moment of our lab, where we were implanting the development of paramagnetic nanoparticles and different types of contrast media for MRI. And we purchased that equipment about 11 years ago at a very critical moment where we needed to develop more applications and applications of MRI contrast agents requiring a clinical field MRI system. So in this presentation, I will organize a few things together in order to make sure that everyone understands the basic of MRI and then how contrast media are gradually used in order to improve the visibility of hydrogels and different types of devices used in medical physics. So my laboratory is implanted at Université Laval in Quebec City. The different areas of excellence of this institution is photonics, optics, lasers, cancer and oncology, but also biomaterials and functional materials. I think we probably figure in the top 3 in Canada in biomaterials and regenerative medicine. And there's a very strong areas of excellence at Université Laval about prostate cancer and brachytherapy. So you will see through this, this presentation that I have many applications toward the field of medical physics. And this is the campus of Université Laval looking to the east, and you can see the St. Lawrence River at the end. So we are located in the eastern Quebec. So Montreal is about half of the population of Quebec, and Quebec City and the greater eastern Quebec City area makes about the other half of the population of Quebec. So our population is distributed on a very, very broad landscape. The geography is vast. And many patients of the Eastern Quebec community needs to travel to Quebec City to receive oncology treatments. So we have the largest health research center in Quebec, and it is the 7th health research center in Canada in terms of funding. So the impact of Centre Hospitalier Universitaire de Québec, Université Laval in the Canadian university system is quite major. We have expertise in cancer, in oncology, regenerative medicine. And my laboratory has focused on biomaterials for imaging. And more specifically, we dedicated our work to material synthesis, materials characterization, and on the implementation in vivo of these new biomaterials for medical imaging applications. So all of our projects require the synthesis of nanoparticles, different types of nanoparticles, mainly gold nanoparticles, and also iron oxide particles. We invent different types of synthesis for the development of more biocompatible materials and different types of nanomaterials that appear bright either in MRI or CT or different types of imaging modalities. And then as the second aspect of the lab, we also characterize the nanoparticles. So we developed a very strong capacity to analyze the nanomaterials, in particular in electron microscopy, X-ray photoelectron spectroscopy, and transmission electron microscopy. And we also have a small animal imaging platform with MRI, CT, and positron emission tomography, where we perform all the proof of concepts for translational research. So technologically, the laboratory is divided into 2 main platforms. So one platform is the biomaterials, nanomaterials characterization platform, and the other one is the small animal imaging platform. And the MR aspect system is one of the main components of this small animal imaging platform. I am also a member of the POND NSERC network, Polymer for Drug Delivery. So this is a NSERC finance network for the development of polymers for biomedicine. So you will see in this presentation many applications of with results that were generated by students who are member of this platform. So I will start with a brief introduction about contrast agents for T1 weighted MRI, because this is one of the specialties of the lab that we developed a few years ago, and well, about 11 years ago when we first purchased the MR system. Then I will describe one of the first applications that we made of with the nanoparticle, the paramagnetic nanoparticles that provide a contrast enhancement for devices. And then I will transfer to the description of biocompatible ultra-small iron oxide nanoparticles that we developed in the lab specifically for as an additive or as an ink for 3D printing. And then I will finish the presentation. I will conclude the presentation with two applications where hydrogels are developed and 3D printed for specific cancer applications. So one is the phantoms for eye cancer therapy, and the other one is hydrogels for gold nanoparticle elution properties in cervix cancer therapy. So this is an outline, a timeline from the beginning of the installation of the system, of the MR-M2 system in 2010 until now. So we used the system for different applications. At the beginning, the system was mainly used for the development of contrast media, paramagnetic contrast media, and also super paramagnetic contrast media. And the more we went to in the research, we started with contrast media research, and then we progressively and step by step started to use these contrast media as an integrated part of biomedical devices. And then we found out that it was very, very useful to integrate contrast media into polymers, into hydrogels, in order to enhance the visibility of different types of medical devices. For instance, biopsy needles, but also hydrogels that are used for 3D printing applications. So in the next slides, I will take step by step each one of these decisions that we made over the years, and you will see the results that we achieved by using the clinical field MR system from Aspect MR. I'd like to introduce biomedical imaging with a specific theory, or like basic theory about biomedical imaging, because there's a lot of unknowns about biomedical imaging. Not everyone knows the difference between CT, MRI, positron emission tomography. So I have this slide that gives pretty much what you need to know in order to make sure that you have the different the main differences between CT, MRI, and positron emission tomography in terms of sensitivity, resolution, and so on. So at the left-hand side, sorry, you have X-ray computed tomography. So the three equipment in the clinics look more or less the same. So for someone who is not versed in biomedical imaging, it is not really easy to see on first sight the difference between an MRI scanner and a CT scanner. But look at the images. On the left side, CT image, X-ray are projected in the patient, and then what you see is a 3D reconstruction of like a radiography. So the bone, calcium-containing materials attenuates X-ray much more. So you have a lot of attenuation in the skull, but not a lot in the brain. So the difference of contrast in the brain are not very good. However, in MRI, you see a beautiful contrast in soft tissues, brain, liver, different types of organs that are mainly have as a characteristic that they do not show a lot of difference in density, will generate very, very contrasted images in MRI. And this is the main purpose of MRI, I think, to emphasize the contrast in hydrated tissues that do not provide a lot of contrast. And then on the right side, you have positron emission tomography, perhaps the most sensitive molecular imaging modality. But today we will speak mainly about MRI. So MRI uses non-ionizing radiation. So this is one of the main advantages of MRI. Basically, the wavelengths used for MRI are radio types waves. They do not alter the tissue. They do not ionize the tissues, and they do not damage the DNA. So this is one of the major advantages of MRI. It takes a little bit more time to scan compared with CT, but it is made at a very, very limited damages for the tissues of the patients. So I like to have also this slide when I introduce the modality MRI. Here you have CT, PET, ultrasound, optical imaging, and their respective biomedical imaging probes, because for each one of these modalities, you can use a specific probe in order either to see something or just to emphasize the contrast on the clinical imaging modality. So for SPECT and PET, positron emission tomography, and SPECT, nuclear imaging, you absolutely need to inject a radioactive tracer in order to get an image. For MRI, you don't absolutely need a contrast agent, but it helps a lot to increase the contrast. So what is MRI and how the signal is generated in MRI? So MRI is based on the excitation of water protons, like mainly hydrogen protons in the water, or in the water that is contained by the human body, can be stimulated. So you take the patient, you insert the patient into the MRI scanner, and the magnetic field strength in the MRI scanner is typically 50,000 times more, so higher compared with the magnetic field of the planet. So it is a very strong magnetic field, and mainly what the hydrogen protons will do is they will orient their spin. Their spins will be mainly oriented into one direction, plus or minus the same direction, and with a little contribution, a very small fraction of the spins will be oriented toward the positive direction, or the positive orientation of the main magnetic field. And so initially you have a random organization of spins, and when you place the patient with all the water protons contained by the patient into the magnetic field, the spins will be mainly aligned along this main magnetic field. And then a radio frequency pulse, a radio wave, will be sent with very specific characteristic of wavelength and also duration and orientation as well. And this specific wavelength will have the capacity to tilt the magnetization vector of the macroscopic signal of each one of the tissues, symbolized here by capital M. So this vector will be tilted in the XY plane, and it will start rotating around the Z-axis. And progressively, when you leave the radio frequency, when you turn it off, progressively the main magnetization vector of each one of the tissues will be recovered. And this gives rise to two different types of relaxation mechanisms, the T1 and the T2. So T1 refers to the longitudinal relaxation mechanism. So this is the typical time by which each one of the tissues will fully recover their full magnetization, the full magnetization of each tissue. And at the same time, there is another phenomenon that occur, like the spins can interact with each other and they lose their coherence around the XY axis. So the rotation of the magnetization vector along the XY plane, around the XY plane, progressively progressively decrease, or it dephases, and we lose the signal quite fast in T2. So there's two ways to generate the contrast in MRI, the T1 weighted and the T2 weighted imaging. So here you have a representation of the magnetization recovery. So the T1 refers to the increase in magnetization observed. So the longitudinal magnetization recovery gives rise to the T1 effect. And the decrease due to dephasing between the spins is called the transverse magnetization coefficient. And this is represented by the right-hand side figure. So all of this, so we don't have too much time to describe the different types of processes for signal generation in MRI, but all of this to mention that signal in MRI is generated by the concentration of hydrogen protons in the tissues, but also TR, the recovery rate, T1, the factor of transverse recovery, of longitudinal recovery, TR, which is the TE, the eco time, and T2, the intrinsic transverse relaxivity factor. So T1 and T2 are intrinsic constant. They are constant intrinsic to the different types of tissue. So fat has a certain T1 and a certain T2, liver has a certain T1 and a certain T2, and so on and so on. So what do we do if we want to change the T1 and the T2 and to improve the contrast between the tissues? Because the basis of contrast in MRI is the difference between the T1s and the T2 between the tissues. So what you can do is to insert gadolinium, manganese of iron oxide nanoparticles. These three types of contrast agent mainly they operate by affecting the water in the vicinity of the tissues. So when water protons come and attach at the surface of a gadolinium chelate or a manganese chelate or also iron oxide nanoparticles, these contrast agents slightly change or they accelerate the relaxation of each one of the hydrogen proton they are in contact with. Iron oxide particles, when they are very small, they act as positive contrast agents. So they have the effect of accelerating the relaxation. When they are a little bit too big, iron oxide nanoparticles kill the signal, and they can be used as negative contrast agents like this. So at the middle of the screen here, you have an example of a negative contrast agent based on large nanoparticles. Typically 10 to 15 nanometer iron oxide nanoparticles will generate this image artifact, while the gadolinium and manganese contrast agent generate the image that you can see on the right-hand side. So this is called the positive contrast. Positive contrast imaging, T1 weighted imaging, mainly generated by gadolinium and manganese contrast agent, while the iron oxide nanoparticles are mainly used to generate negative contrast. So the positive contrast agents are based on gadolinium. So the element gadolinium has the capacity to strongly influence the spin of hydrogen protons. So they have the capacity to trigger energy release from the hydrogen protons. And this is due to their specific paramagnetic properties. And water protons that bind to a specific site of the gadolinium they are affected by the presence of gadolinium. And at every nanosecond, there's a certain number of water protons that attach to gadolinium and that go out. And this gives rise to this beautiful contrast enhancement effect that you see on the right bottom image. This is probably a glioblastoma multiforme before and after intravenous injection of gadolinium. So you can see that clearly this increase in MRI signal is due to the presence of gadolinium in the blood of the injected patient. And all of this can be predicted. These contrast effects can be predicted by the equation of signal, where rho is the concentration of hydrogens in the tissue, T1, the longitudinal relaxation factor, T2, the transverse relaxation factor, and T and TR are basic parameters for MRI scanning, like eco time and transverse relaxation. So, and with all this, when a chemistry laboratory dedicated to contrast media research wants to demonstrate if whether or not a contrast agent is ready for injection in vivo, one of the typical tests is the contrast media test using MRI. So basically, here we have iron oxide nanoparticles and gadolinium oxide nanoparticles. This one is mainly a T1 weighted contrast agent, and this one is mainly an iron oxide based negative contrast agent. So we perform these in vitro tests by using Eppendorf tubes that contain dilutions of the solution, and you have the concentration in gadolinium and the concentration of iron below each one of the images. And this is performed at clinical magnetic field strength. So 1 Tesla, the contrast effects would be somewhat different if the test was performed at 7 Tesla or 9 Tesla. So mainly the main preclinical MRI systems used for neurological studies in rat brain, for instance, they are mainly performed at 7 or 9 Tesla. But if you use these systems, you will not have the same, you will not generate the same contrast enhancement effect compared with 1 Tesla systems. And in the clinics, you have 1.5 Tesla systems or 3 Tesla systems, but not really systems that operate at higher magnetic field strength. And with this, I will introduce the first applications. So once you have the contrast agents, you might want to use the contrast agents either for a direct systemic administration in the animal or in the patient, but you can also want to introduce these contrast agents to emphasize the contrast of devices that you might want to see in MRI, because all of the devices are not evidently image and contrasted in MRI. And one of the specific applications we started with about 7 or 8 years ago was the biopsy needles. One of the reasons why biopsies are not very often performed with MRI is the lack of precision of biopsy needles visible in MRI. So usually biopsy needles are made of they are made of stainless steel, and stainless steel cause a very strong image artifact. In this case, a 1 millimeter diameter biopsy needle is visualized in the form of a 7 millimeter image artifact. So this very strong image artifact is not representative of the geometry of the needle. And when comes time to perform a very small biopsy of 1 or 2 in a nodule of 1 or 2 millimeter in diameter, and often less than that, it is problematic. But what happens when you take a heavy needle, or a needle made of metal, or a needle made of plastic, completely exempt of water, and you want to generate MRI image? Well, at the place where the needle is inserted, you push the water out. And remember, MRI is an image that reveals the presence of water in the body. So we try to keep as much water in as possible in the coating of the needle. So this was the strategy here. And in this representation, you have a voxel of MRI. So a voxel is the basic unit, the volume unit of imaging in MRI. So a basic voxel is 1 millimeter times 1 millimeter times 1 millimeter, if we make an approximation. And what happens when you insert a needle, well, you will push a lot of water out of that voxel. So this voxel eventually will not give signal unless you add a certain coating that contain water. So if the coating of the biopsy needle is made of at least 70% of water, then it will be able to generate a signal. And if you use gadolinium as a contrast agent enhancer, can be gadolinium or manganese, you put that into the coating, and then it will accelerate the relaxation rate of water into the coating. And this strategy was used in our team to generate a contrast enhanced coating for metallic devices, and more particularly for ultra small, biopsy needles, not necessarily ultra small, but biopsy needles in general. And the base material is silicon nanoparticles, which contain 70% of water. And at the surface of these nanoparticles, we grafted gadolinium. We can also graft manganese. Any paramagnetic MRI contrast agent can work on this system. And so the titanium needle, so instead of stainless steel, we replace the stainless steel by titanium, because titanium generates less image artifacts. So a specific grafting was performed, preparation of the titanium-based substrate was performed, followed by an encapsulation step where nanoparticles were mixed with a certain type of polymer that provides a certain mechanical strength. And this type of polymer is similar to what is used for the white fillings in the dentistry industry. The main difference was that we tried to keep a high porosity. So instead of a white filling for the dentistry that does not absorb water, we have something that is extra porous and that leaves the water. The water can be fused to the silica nanoparticles, and the water can be triggered by the gadolinium in order to make a signal enhancement effect. So basically, the thickness of the coating is between 50 to 200 microns, which is, it can fill out a very significant fraction of the MRI voxels. On the left side, you have a typical biopsy needle, then the hydrogel coating with gadolinium and without gadolinium. And this image is generated by the MRI system in a few seconds only, and you can clearly see a delineation of the coated titanium needle. So this is a longitudinal section, and these are cross sections of Eppendorf tubes that contain titanium needles with a specific coating. So we demonstrated the possibility to visualize the contours of the biopsy needles with spin echo and also with gradient echo, and with a few seconds only to generate the images. So the challenges in biopsy for MRI is also a matter of, so the practitioner or the doctors who practice biopsies, they need to insert the needle at the same time as they see the image. So being able to insert and at the same time visualize where the needle is absolutely essential. So this was the first success of a contrast enhanced coating for biomedical devices. And then we wanted to move in the direction of in vivo implantable objects. Gadolinium, unfortunately, and manganese are not that biocompatible. So it is absolutely not possible to implant objects that contain gadolinium. There's a little bit more possible with manganese, but gadolinium is a big no-no for the FDI. So in order to contour that difficulty, and knowing that we need some time to improve the visibility of hydrogels or different types of water containing polymers in vivo, while avoiding the problem of gadolinium toxicity, we designed ultra-small iron oxide nanoparticles. And we were one of the first laboratories to design ultra-small iron oxide nanoparticles of a size small enough to generate a positive contrast in MRI. So for this application, we partner with my collaborator, John O at Concordia University. So Dr. John O is a specialist of multidentate block copolymers. So type of polymers that strongly attach with multiple feeds or multiple chemical junctions at the surface of the iron oxide nanoparticles. And this improved stability is absolutely essential for the success of this technology. So we developed the iron oxide, the ultra-small iron oxide nanoparticle synthesis, and they developed different types of polyethylene glycol PEG-based multidentate copolymers that provides a very, very strong stability to these ultra-small iron oxide nanoparticles. So this here you have a transmission electron microscopy image of these ultra-small iron oxide particles. They have a hydrodynamic diameter of about 9 nanometers, so well below the thresholds above which iron oxide can be used as negative contrast agent. So we really kept the product in the positive contrast agent capacity. And we demonstrated with the clinical field MRI system the capacity to generate a positive contrast and an absence of artifacts or negative type artifacts in these images. So, and this is where we started to use more and more the MR system for in vivo injections and mice monitoring. And here you have a demonstration of systemic injection, intravascular injection of iron oxide ultra-small nanoparticles injected. So this is before injection and then after injection. And you can see that the blood signal increases in the first minutes after the injection, and then this signal enhancement signal enhancement is kept for at least 1 hour after the injection. And the iron oxide nanoparticles remain in the blood for a much longer time compared with the, compared with gadolinium chelates or manganese-based chelates. So we performed in this paper the T1 weighted imaging and T2 weighted imaging. We could clearly demonstrate that the iron oxide nanoparticles can be used both as a T1 enhancer and a T2 enhancer. So for positive contrast and also for negative contrast, when we need to perform a negative contrast visualization, we also can perform, we can do it. And we also compared this iron oxide nanoparticles with different types of commercially available iron oxide nanoparticles. And we followed also the capacity of the nanoparticles. The iron oxide nanoparticles were integrated in alginate. Alginate is one of the most widely used hydrogels for regenerative medicine. And in this study, we wanted to demonstrate the capacity of alginate as a hydrogel to sequestrate the iron oxide nanoparticles and to keep the iron oxide nanoparticles for a long period of time, relatively long period of time. So this is the contrast between the iron oxide nanoparticles sequestered in the alginate before, and around the bright spot, you have water. So this is just for a matter of contrast measurement. So at zero time, 24 hours, 48, 7 days, and even after 30 days, there was a certain contrast enhancement that was remaining. So a significant fraction of the iron oxide nanoparticles can remain in the hydrogel. And here you have also the in vivo proof of concept after IV injection, 8 minutes, signal enhancement in the blood, and progressively, step by step, you see the liver begins to turn a little bit more dark and darken and darker hour after the hour. So this is because iron oxide nanoparticles are metabolized by the liver. They are taken up by the Kupffer cells, and they will progressively be degraded by the Kupffer cells. But we also noted that the gallbladder, the signal in the gallbladder starts to increase after a few hours, and this indicates that a significant fraction of these ultra-small iron oxide nanoparticles are progressively eliminated by the gallbladder. And this is when we started to use the ultra-small iron oxide nanoparticles as an ink for bioprinting applications. And we started with an application where we needed to generate a porous network of alginate hydrogel, and these pore networks are oriented toward tissue engineering. One of the main limitations of 3D printing for tissue engineering is the difficulty to irrigate the hydrogels with a vasculature. And the vasculature has a difficulty to grow in different types of hydrogels, such as alginate, because there's no porosity that makes it accessible for vascular growth. So in this strategy, we partner with one of my colleagues, André Bégin-Rollet from Université Laval, and André he's the inventor of a sugar printer. So what he does is to 3D print network of filament made of caramel, basically. So they use caramel and they carefully knit networks of caramel. So these network of 3D printed sugar are also then they are used to cast alginate. And alginate is a specific molecule that comes from the seaweeds, and it's polymerization. So alginate polymerizes by adding calcium. So you add calcium to alginate, and then it will form cross-links between its different moieties. So when the alginate is formed around the sugar mold, then you let the sugar dissolve by the water, and when you rinse the hydrogel from all the sugar that dissolves, you get a template. And this template is an intricate network of gel that contain porosity, and these porosities are open for vascularization to grow inside of the implant. So basically, what we orient this type of technology to the 3D growth of adipose tissue. Adipose tissue, which is used for breast cancer surgery or maxillofacial surgery in order to implant lipid tissue. One of the main limitations or the main challenges is to keep a certain oxygen level and a certain level of food to the cells that grow into these hydrogels. And you cannot do that unless you provide a porosity in the hydrogels. So with this casting technique, we can do it. The problem we had for using MRI as a measurement assessment technique was that before you use iron oxide nanoparticles or ultra small iron oxide nanoparticles, you don't clearly see the hydrogels. Remember, a hydrogel is 98–99% water and a very, very limited fraction of polymer. So not really enough to exacerbate the contrast between the hydrogel and the porosity. As from the moment we started using the ultra small iron oxide nanoparticles, then life was much more easy for the students because they could have a clear delineation of the contours of the hydrogels versus the contours of the porosity. And with this, it was possible to delineate the contours of hydrogels and distinguish the hydrogels versus the porosity. And now what we are doing is to demonstrate that this specific hydrogel with iron oxide nanoparticle ink can be safely implanted on the flank of the tumors. So this is an MRI. MRI study from day 0 to day 14, flank injection of alginate supplemented with iron oxide nanoparticles, and we monitor closely the volume of these grafts until day 14. And you see here the control is alginate only, so alginate without iron oxide nanoparticles, and you see that this contrast, there's no signal inside of the hydrogel. So we found that for contour delineation assessment, it is much easier to clearly visualize the contour of the graft if there is a very small fraction of iron oxide nanoparticles. And with this, it was possible to monitor the volume remaining in the xenograft in the graft for a duration of 2 weeks. We also performed blood collection at the same time to demonstrate that there was no sign of inflammation. We performed the histology, and we'll go fast on this. We also demonstrated that when adipose cells or stem cells mixed with these hydrogels and with iron oxide nanoparticles are differentiated, they keep their differentiation potential into adipose, into adipocyte, like the fat, the cells that will populate these adipose tissue grafts are adipocytes. But first, you need to start with cells before differentiation, and at a certain moment of their culture, you need to trigger the differentiation into adipocytes. And we demonstrate that the hydrogel does not affect the potential of differentiation into adipocytes. So what we are aiming for is the development of 3D printed shapes, formed hydrogels containing porosity and containing cells ready for differentiation into adipose tissue. And we collaborate with orthopedic surgeons and maxillofacial surgeons who need more fat tissues in order to implant patients with anatomically relevant shapes. So this is where the technology is at the moment, and we are step by step transferring the technology and collaborating with the LOEX, the laboratory for Laboratoire d'Organogenèse Expérimentale at Université Laval, and they are expert in the tissue engineering of fat tissues. So next step, 3D printing, more 3D printing, and we mainly perform our proof of concepts with a BioX printer. It is not a printer that allows necessarily ultra ultra precise, ultra high resolution printing, but for proof of concepts of what we are doing in contrast enhancement studies, it is a very good multimodality tool. With this, I will introduce the two last examples of the presentation, namely contrast enhanced biogels for eye cancer phantoms, and I will continue with the hydrogels for cervix cancer therapy. So brachytherapy implants are radioactive plaques that are used for prostate cancer, breast cancer, but also for eye cancer. Possibly 70% of all eye cancers in Canada are treated by the insertion of a radioactive plaque. And this plaque is called the episcleral plaque. It is made of metals with a silicon mold, and inside of the plaque, you can find radioactive sources. And these sources, they look like rice grains. And these rice grains are radioactive. They contain iodine-125 or palladium-103. And at the moment, the shape of these plaques are generic. So they are made on approximations of the general geometry of an eye for a male patient of 35 years old and something. So they are really approximation of the general population. However, eyes are elliptic. They are specific. The shape of eyes are very specific to each one of the patients. And also the cancer does not grow at the same place and not according to the same geometry. So there is a very strong need in the field of brachytherapy to adapt brachytherapy plaques to the specific characteristic, geometrical characteristic, and also the specifics of the different types of cancer typical of uveal melanoma. One important concept in medical physics, so we work for the development of a 3D printed episcleral plaque treatment. We work a lot with medical physics experts, and the medical physicist in any hospital where brachytherapy or radiotherapy in general is applied. So the main role of medical physicists is to calculate the dose that a radioactive element or a radioactive implant, so the energy dose that will be deposited in the tumor adjacent to it. So these lines are dose contours. So they represent the level of energy that will be deposited in a simulated tumor, just besides the radioactive plaque, just close to it. And so the tissue located very, very, very close to the radioactive plaque will be treated with more energy, so the cells will be killed more rapidly. One of the difficulties in episcleral plaque brachytherapy is that this shape here, this ovoidal shape that represent the tumor, it is rarely, in general, it is not a very clear ellipse. It can have the form of a mushroom, or it can have different, a variety of shapes, and sometimes it is located very close to the optical nerve. And in case it is located close to the optical nerve, the patient can see its visit. So the vision can be altered because of the radioactivity treatment. So something that we want to do is to make sure that while we develop these radioactive plaques, we also develop phantoms, like hydrogel-based tools that will assess the precision of the dose contours before the radiosurgeon takes the radioactive plaque and implants it in the patient. So we closely work with medical physicists who are expert in the dosimetry contours, and we develop the hydrogel that are useful to the medical physicists in order to make a more precise dose assessment before implantation by the radiosurgeon. So for this, we develop different types of hydrogel formulations, and the hydrogel formulations are 3D printed in the form of a shell. So a shell that represents the sclera. So the sclera is the outer envelope of the eye. And we need also to demonstrate, so we develop hydrogels that are used for dose contour assessment, but also hydrogels that are used for cell viability assessment. So what we need, we don't need to 3D print exactly the functions of an eye, but we need the sclera and the choroid. And in the sclera, we have collagens, we have proteins, and we have fibroblasts. And there's also a certain presence of melanocytes. So the hydrogels that we develop in the shells that will be used as a phantom for medical physics assessment also need to be a balance between collagen, proteins, fibroblasts, and melanocytes, because we need to generate those contours that are as close as possible to these biological systems. And also there's the choroid. Sometimes the cancer forms in the choroid, and we need to adapt our strategy because with respect to these two types of applications. So the hydrogel is a layer, the bioprinting of the hydrogel is a layer by layer production method that allows complex geometry printing. And we need to keep good mechanical properties and high cell proliferation. So mechanical properties are we can keep the good mechanical properties by using alginate. This kind of polymer helps us to preserve a certain mechanical strength, and then cell proliferation by adding collagen. And so rapidly, I will move a little bit forward. So we 3D print shells made of hydrogel with and without additives such as xanthane gum. And reaching a very high level of viscosity or a very optimal level of viscosity is absolutely important in this kind of application, because otherwise you lose the very thin layer of hydrogel that is needed for the medical physics phantom. So for this, in order to support the hydrogel, you need a lattice. We need a lattice support that is 3D printed with nylon mesh. And then the bioprinter deposits a very, very small filament of hydrogel by using a series of elliptical paths. And MRI is used at this step in order to verify and measure precisely that the hydrogel that is deposited layer by layer remain of a certain thickness. So you see here the contours of the so-called eyeball, 3D printed with collagen and alginate. And so this is a half sphere. So you have the cross section here and you have the coronal view. And MRI is very, very helpful for us to make a very precise measurement of the cross section, the thickness in the cross section, and the thickness in the coronal view as well. And finally, I will go very fast to the cell viability. Of course, we want to use this hydrogel system also to insert cells, and we will use the cells for dosimetry assessment purposes. I will not have the time to talk about it today. And we perform the cell viability assessment in order to make sure that the cells, the choroid fibroblasts, and the different types of oval melanoma cell lines can survive and are not affected by the presence of the hydrogel. And now our current research activities are for the demonstration of the two types of hydrogels, the dose control hydrogels and the biological hydrogels are used for assessment of those contours in partnership with medical physicists. And finally, I will take 3 minutes to introduce the last concept, which is the use of hydrogel gold nanoparticles. So hydrogels that contain gold nanoparticles for elution applications oriented to the treatment of cervix cancer. So gold nanoparticles, are very efficient dose enhancers in medical physics. So when you bring gold nanoparticles into a flux of high energy photons, gold nanoparticles can multiply the dose into the tissues by a mechanism that will be described in the next slide. So in this project, we synthesize ultra-small gold nanoparticles. We mix the gold nanoparticles with pluronic and alginate. Pluronic is a biocompatible polymer that has the capacity to dissolve fast, while alginate is a polymer that keeps its integrity for a longer period of time. And we want to have a hydrogel that slowly released gold nanoparticles on the wall of the vagina for a period of about 3 or 4 days. Why this window? Because we want to match this gold nanoparticles elution kinetics with brachytherapy treatments or with radiotherapy treatments. And so you would first apply a layer of hydrogel where the cancer is developed or on the cervix, and the gold nanoparticles would elute for several hours, followed by a radiotherapy treatment. And for this, we need to carefully monitor and measure the precision at which the gold nanoparticles elute, the time precision, and also we need to evaluate the capacity of the hydrogel to remain in a certain mechanical strength and a certain shape over a period of 4 days. So gold nanoparticles are high Z materials, and high Z elements presented to a flux of high energy photons have the capacity to generate secondary electrons, secondary photons, Auger electrons, and so on. So this is called the radiosensitization effect. The more high Z material you have in a tissue, and the higher production you will observe of reactive oxygen species, secondary electrons, and Auger electrons. And all of this cocktail of production is possible only when you insert gold nanoparticles in a tissue to a flux of high energy photons, such as those that are used in medical physics for radiotherapy treatments. So the strategy here is to use rather like mid-low energy photons, such as those produced by brachytherapy seeds, iodine-125 and palladium-103. These low energy photons interact very, very efficiently with gold nanoparticles. And then you also need to administer the gold nanoparticles where the cancer is. You need to leave the gold nanoparticles to enter the cells. They need to integrate the cells, and at that precise moment, then you can administer the radiotherapy treatment. So nanoparticle administration and nanoparticle elution is a critical aspect of that technology. So this is a study that was performed by Heidfin and al. In 2004 that demonstrated the impact of gold nanoparticles coupled with radiation on the capacity to control tumor volumes. So for this application, we use a mixture of pluronic and alginate. So pluronic is a synthetic material, and alginate is a natural hydrogel that comes from seaweeds. Alginate cross-links with calcium, and pluronic is thermosensitive, so we can manipulate it, and we can play with the temperature to change its characteristic. And we mainly use pluronic for its capacity to deliver the gold nanoparticles during the first hours. And we use alginate for its capacity to remain on the site and to provide a certain grafting on the vaginal wall. And so this is the 3D printed procedure. So we 3D print with the bioprinter, and we cross-link the hydrogel with calcium. The nanoparticles are integrated into the hydrogel. And we also use a lot of scanning electron microscopy in order to monitor the porosity in the hydrogel structure. So at day 1, day 3, day 5, you see that the more pluronic is dissolved and the bigger the porosity in the material. We also perform the cytocompatibility assessment rapidly, and the implantation in the animals is performed. And here we use MRI not for its capacity to visualize gold nanoparticles, but for its capacity to strongly delineate the implants. So hydrogels are implanted on the flank of the animals, and the biocompatibility is measured by blood sampling, but also the capacity of the hydrogel to remain of a certain shape and certain volume over time is monitored and measured by MRI. So this is the in vivo degradation profile measured by MRI, immunohistochemistry rapidly to verify if whether or not cells proliferate into the hydrogel. And this is a demonstration that what we are doing at the moment, so we are developing different types of shapes. So these hydrogels that contain gold nanoparticles are shaped in different geometries. And these geometries will be inserted in the small animal to mimic the gold nanoparticle elution therapies followed by radiotherapy. And for this, MRI, once again, is very, very useful because we can perform cross sections and coronal measurements, very, very precise assessment by using a mixture of T1 weighted and T2 weighted imaging procedures. So MRI is really a measurement tool for us in the development of 3D printed hydrogels. So in conclusion, you have seen that biocompatible polymers and hydrogels are often necessary for a variety of applications and for the development of effective therapeutics, and in particular therapeutics that contain nanoparticles. Nanostructures, materials for contrast enhancement and MRI are necessary to design biomedical objects for diagnostic and therapeutic purposes. We have seen that there are different strategies to improve the contrast and the signal in MRI of these different types of hydrogel-based materials. And we have developed ultra-small iron oxide particles that makes the hydrogel more visible in MRI. And this product is also biocompatible. And with this, I would like to acknowledge my team, my research associate, my students. This is their work, of course, because they are in the lab and I am not. I also would like to acknowledge my collaborators, Dr. Luc Beaulieu in medical physics, Dr. Claudine Belrive in the surgery room, Dr. Solange Landreville, and Dr. Julie Fradette from the Laboratoire d'Organogenèse Expérimentale Tissue Engineering. And I would like to also make an announcement for the Gold 2022 conference. I'm chairing that conference. And this conference is about the different topics of gold-based materials for high technology. So if you are interested to participate in a conference about the high technology of gold, and in particular for biomedical applications, I invite you to go to this website, and we have a series of webinars also that are organized every month. So that might be of interest for you. And with this, I would like to conclude my talk. Thank you, and I will be very happy to answer your questions.
Excellent. Thanks, Marc-Andre, for such a fascinating presentation. I know going through the slides beforehand, I was quite excited to see and hear Marc-Andre's presentation. We have reached the 60-minute mark, but there are just a couple of really interesting questions that I think it would be great to address for those of you who have to drop off because you have prior commitments. I completely understand. But first, Marc-Andre, the MRI studies that you described in this presentation were performed with the aspect imaging system, which does operate at 1 Tesla. But can you comment on the advantages and or the limitations of performing such research at 1 Tesla compared to higher field systems like 7 or 9 Tesla?
Yeah, that's a good question. I think that the main the decision-making point in tissue engineering and for 3D printing and the applications that I mentioned here, one of the decision-making aspects is the capacity to visualize a contrast and MR signal in the same condition as what would be possible with a clinical field. So very often, the closer you work to the clinic with the clinics, and the closer to the clinics you want to validate certain technologies. So I would give an example: a radiosurgeons who really want to make sure that the hydrogel that I give to the surgery room will perform at clinical field does not want results at 7 or 9 Tesla, because many of the hydrogel that you can see here will not perform very well at 7 Tesla or 9 Tesla. Sometimes the concentration of gadolinium must be increased, sometimes it must be decreased, sometimes iron oxide will simply not work very well as a positive contrast enhancer at 7 or 9 Tesla. So depending on your level of closeness to the clinics, you want to generate data that is as close as possible to what a clinical system will offer to your clinical collaborators. Neurology, neurosciences, I would say, is different because in neurosciences, you really want resolution. And to reach the same level of resolution and contrast to noise ratio, as with a 9 Tesla system, with the aspect system, you would probably have to scan for such a long period of time that it would be problematic for the animal to keep the animal under anesthesia would be problematic. So neurosciences, high resolution application of small brains, mice brain or rat brains, probably the 1 Tesla system is not the best tool. But to keep as close as possible to the contrast generated by clinical system, and including for regenerative medicine and cancer research, it is really great.
Perfect. And one last question just before we wrap up. To visualize the hydrogels in MRI, is it necessary to use the contrast agents like you described? Or can you comment on the feasibility of performing non-contrast enhanced MRI in hydrogels, perhaps in follow-up studies?
It is not always, of course, MRI is an imaging modality that performs by stimulating water and extracting energy from water. So if you have water, you have signal. Contrast agents will be used, are useful. They are not always necessary, but they will be useful when you need to exacerbate the contrast difference between two tissues or a hydrogel and the water. So I would say that in the case of the flank administration in the mice model that I showed in 2 of the applications, sometimes it is not absolutely essential to add contrast media. It is absolutely essential when you need to make a strong difference between the tissues outside of the implant and the implant itself. If you want to accelerate or use numerical automated tools to extract volume, the level, volume delineations or segmentation with automatic tools, very often it is absolutely necessary to add a certain contrast media, because otherwise the level of contrast between the muscle and the implant will not be that good. Whereas with the fat and the implant, it will be too exacerbated, and this leads to other types of imaging artifacts.